Welcome to Calm Your Grits podcast. I'm your host, Joey Allen. I'm just your average stay-at-home mom, homeschool mom, and wifey who loves all things sparkly and anything DIY. Basically just a crazy Pinterest mom. Oh, and I've also recently jumped into the pageant life. I'm a self-proclaimed expert at nothing other than hanging on by a thread. I am living my best life during what I could only describe as my midlife crisis. This podcast is about nothing and everything. Whether you're here because you could relate or for comic relief, my hope is that you'll walk away learning something new or at least feel a little less weird about the voices in your head and the decisions you've made in your life. Hello and welcome. Today I'm joined by a very special guest, Dr. Thorne, who played a crucial role in my postpartum depression journey. We're going to talk about what puts moms at a higher risk for postpartum depression. Well, it's not called postpartum depression. We'll get into that. What puts moms at a higher risk and what they can do about it, as well as you probably get to hear about some of our experience working together. So Dr. Thorne, or as I like to call you since now we're buddies, Judy, could you please introduce yourself and tell us a bit about your background, kind of what inspired you to specialize in postpartum depression and maternal mental health?
Hello, I'm Dr. Judith Thorne. I'm a licensed clinical psychologist in the states of North Carolina, South Carolina, Virginia, Pennsylvania, and Massachusetts. Prior to my doctoral program, I also have a master's in applied behavioral psychology. So I have 2 masters and a doctorate. And I did not start out with perinatal mental health. What happened was my best friend in New York had postpartum psychosis 3 times. And that got me thinking about it. Then I wound up having a postpartum anxiety disorder. So when I went for help, there wasn't much help here back 28 years ago. So I kind of dove into the area and got really educated, did research and certifications, lots of understanding, reading books, then started seeing people.
Okay. Well, in previous episodes, I've shared how I had been to therapy, worked with psychiatrists, psychologists, all the things before having Lydia, and I considered myself a mental health veteran,
Right.
meaning I wasn't opposed to being treated for mental health or medications or anything like that. But even for me, like I didn't really understand what it was. Like postpartum depression, all I knew was that it was that you couldn't connect with your baby, or that you weren't attached or something like that. And for me, it was like the complete opposite. I was like obsessed with her
Yes.
and terrified that something was going to happen to her. So could you help us better understand what postpartum depression is and how it's different than just the baby blues?
Yes, yes. Well, the perinatal period includes pregnancy and 1 year postpartum, but you can have a postpartum disorder up to 2 years postpartum, and it can start at any time during that first year. Okay, so that's really important because a lot of people think that they're out of the postpartum period after they go to their OB appointment at 6 weeks, and that is not the case. It's not just depression and psychosis, which we see on the media and on TV. It can include anxiety, OCD, bipolar, and post-traumatic stress disorder. So, in addition to that, usually people have a combination. It's not specific to one of those disorders. You'll see somebody having a smattering, a little bit of this and a little bit of that, and every woman can be totally different.
That makes so much sense. I think I had every single one of those. Baby blues, I remember, was something that I read about in the books and all that. And when I first got home, I was like, it's just that, because I remember just crying and I don't cry. So what would the difference be between baby blues and full-blown postpartum depression? And if you get the baby blues, do you automatically get postpartum depression, or like what's the
No,
difference?
no. Within 24 hours of giving birth, you have a great reduction in hormones. There's a major change physiologically in your body. So for your body to regulate, it takes about 2 weeks. So generally we say, that's why I say to people, come to me at the 3-week mark, because where baby blues is going to be crying and feeling sad and having some mood issues. But if symptoms are severe or they're after that 3rd week, then I say we're getting into a different area. And
Okay.
no, they don't lead. You could have baby blues and not have any postpartum issues at all. Also remember, loss does the same reduction of hormones, right? So if someone has a loss, they had all those hormones in their system as well. So they can also have symptoms that
Right.
are
Outside of,
very similar.
right. Because I mean, the obvious would be, a miscarriage or something like that. Like, obviously, that's sad. But then on top of that, you throw in
The
all these
hormone,
hormones. It's like, yeah.
right? Especially
And
in the case of women that are down the road a bit in their pregnancy and then have a loss.
yeah. Okay. So baby blues would just be like the crying. I remember I dropped something and I started crying. But because that was very much not me, I was just like, oh, this has to be the baby blues. So I just kind
Right.
of chalked it up
Yes,
to
but
that.
it's also severity of symptoms. So we want to look at like how bad the symptoms are. Unfortunately, postpartum psychosis, that is 1 to 2 per 1,000 births, does usually happen within that 2 to 3 week time too. So we do have to pay attention to the symptoms and how
Okay.
bad they are. Intrusive thoughts, delusions, hallucinations,
Okay. That's good
making
to know.
sure we're checking in on the person and what their symptoms are.
Okay. So, what are some of the risk factors that increase the likelihood of a new mom developing postpartum depression? Or what are we calling it now? Perinatal mental.
Health,
Okay.
yes, perimental mental health disorders.
Okay.
Well, there's some of the ones that we would think, previous psychiatric issues, any issues with alcohol, eating disorders, things like this. However, there's ones that we don't think about. And I actually give out this sheet when someone's in my waiting
Oh,
area
I remember that one. I remember that sheet.
with all of the risk factors on there, because if I could show a woman like, oh, look at all these risk factors you had, then they don't take such the blame as they're the problem or the one who's broken. So these can include like having a big one in this area is no family or social support. If
Yeah.
you see my phone, the people that I get coming into my sessions, they're usually from another state. Every area code is usually different. So here we have people coming to make this great life for themselves as a couple. Then they have a baby. Then they're like, where's my family? Or I miss my family. Because we don't think that we need the tribe that we do. So that to me is a significant risk factor. And I always wanted to do a study on that, about how many women check that box, family, social support. I put within 30 minutes because I mean support like, can you get me some milk from the store? That kind
Right.
of support. So, but also someone like you, any previous losses? So women who think that if they've had a loss, that, well, I love this baby so much, so I'm not going to have anything. Well, it actually makes you more at risk for having postpartum anxiety, depression, etc. So I wish that we could have these risk factors shown to people before, especially something like type A personality. Many of the women that I treat are very, very high functioning. They come in, they look better than me, they put on the face and the mask, and no one would ever know what's going on internally. So, they're also women who are not used to being taken care of. So, when we talk about treatment, it's a very delicate balance of respect to make sure that you are being as respectful as possible to this woman who usually takes care of everyone else.
Wow. I mean, that gives me goosebumps. Takes me back because, I mean, and that's exactly how my experience was when I met you was, when I saw it, when that that questionnaire, when I saw it in black and white and you were able to explain it in a way that was like, okay, well, you check this box, this just puts you at higher risk. Like there's nothing wrong with you. I mean, other than having postpartum
Right.
depression, but like, that was, I remember, and the way you talked to me like I was a human being, that was, and you kind of like got on my level, and said it straight. And it's like, you have a gift for that, for like being able to just say things in a way that doesn't come off like you're talking down to someone or that there's anything wrong. You're like, it's okay and we're going to figure this out. Like that's, I think, one of the main things I remember from back then. Like once my friends got me to you, I was like, all right, I'm in the right hands. And that's unfortunately that's not the case for a lot of women. I've heard stories that they will go and even knowing that they have postpartum depression, they'll go to get treated and are told to go for a walk or
Yeah. Yes.
just like
Yes.
like they're soon doing something wrong.
Yes. I always say postpartum is a different animal. If it was anything else, like God forbids your partner has cancer or something, you wouldn't make them run a marathon. So why would we do that when someone is mentally not well? I always say we have to get your head above water before we have those things. Now, if you want to get some sunlight, if you want to take a walk, fine. But I want comfort for you, for the mother. And I say, if you want to just sit on the couch with your husband and hold his hand and not talk, that's fine with me. I just want you to get well. So we're going to help you to get well, just like we would do any other illness.
Right. So what does treatment look like? And I know everyone is different based on your experience. What have you noticed that has been one of the most effective ways to help moms recover?
Well, I do think a lot of times this is their first time on the couch and they don't really want to be here. So being respectful and just, it's a lot of education and understanding and helping and being supportive and empathic. But it is also very direct and educational. It's not like traditional therapy. We're not going to rewire the house. We're going to put the fire out. Okay. So I
Oh,
want
yeah.
my women to get better as quickly as possible. So I'm gonna talk to them about, where are you changing the baby? Where is the baby? If I want your feet not to touch the floor as much, so put the baby next to you, change the baby at the bottom of the bed. How much sleep are you getting in a row? Can we move the bed? I don't care about what the room looks like. Let's put a refrigerator and a microwave up in your bedroom. Whatever we could do to have that mother be cared for.
Remember that. Your feet don't touch the ground. Oh,
Yes,
it's like,
yes.
feet can't touch the ground. Sorry, babe. You're going to have to get that.
Well, and that is part of treatment. And by the second or third session, I like to bring the partner in
I remember
because
that.
they need to understand this, because they are often like, where has my person gone? Where has my wife gone? I don't know this person. This is very foreign to me. So they're in a total different land and don't understand either. So educating the partner and what's going on. I always say, you're like a turtle without a shell. Everything's hitting you like so intensely. The light, sound. I remember one man saying to his wife, "Your friends are calling and you're not picking up the phone. If you were thirsty, wouldn't you take a drink?" And I said to him, "If you didn't have the strength to pick up the glass, you can't take the drink."
Wait, was
Because
that my husband?
no, it was not your
I
husband.
bet it
But it was
was.
many years ago. It was many years ago. What I try to help them to understand is we just have to rebuild. All the coping, a lot of the women that I treat have probably had generalized anxiety disorder prior. Okay? So anxiety symptoms that aren't that terrible, and they package their lives a certain way to keep those symptoms down. Lists and cleaning out closet, and I'm gonna, make sure I do these kinds of things. And then when a baby comes, that all explodes. So all of the things that they are used to doing to cope, now they cannot. And a lot of women, when I say that, the type A personality, they're like, oh, yeah. And they feel, I said, no, your personality got you this far in life. It just doesn't totally match with a baby. So we just have to get some other coping strategies in place. I always say it's to be understood is not to be judged. We need to, help understand how we got here, not judge it, and
I
get
love
you
that.
better as quickly as possible. So treatment can include medication. It's definitely, therapy at least once a week, I would say, and that could be virtual or in person. A lot of women do like in person, after COVID, of course. They want the connection, but I find virtual is just as effective. But getting the husband in, I did a sponsorship program at one point where I helped a woman that was not well get connected with a woman that went through this and is well. And like you're doing in your group.
Hmm.
Because sometimes my women, and I could think of one in particular, and she knows who she is, would leave the room and say, Dr. Thorne doesn't know what she's talking about. I'm never going to get better. And she would tell me that she would say that. And it took a long time, for us to well, it wasn't that long. It was a few months that she started really feeling better. But that is what women feel like. This is my new normal. I am not going to get better. Like, so that is really helpful to tell them, I promise you, we're going to get through this. It's just that, again, personality wise, I can't tell you do A, B, and C and you'll be better immediately because they will if I told them that.
Hmm.
They will do that. It's just a process, unfortunately.
Yeah. And with medication, oh, the medication part. I remember like everything was like, yeah, okay, try this 4 to 6 weeks. Let's see if it helps. And then, so I, what was huge was I think by the time I had Dylan, there was a test that could be done to see like what your specific DNA and medications
Oh,
would
yes.
be best. And it was like green,
Yeah,
yellow, and
gene
red. So
site
like,
testing. Yes, yes.
yes, which I thought was great. I was like, why doesn't everybody do this? And for me, when I saw that list, I could literally like everything on my red,
Was
like everything that
you
like I
tried?
had tried. Yeah.
Yes.
And then there were only like two on my green. So it's very eye opening. I love that kind of stuff where it's like, okay, kind of take like it's black and white, like it's
Right.
your DNA. That's how it works. But I mean, and even that's not foolproof. That doesn't
It's
mean that, okay, just because you take this, you're going to be fine. There's like
right.
doses
And
and
some people don't believe in the gene site testing and so it's there's some controversy over it. I've had people do it. Historically, if you've been on something before, generally the doctors will do that or the ones that are safest with pregnancy or breastfeeding.
yeah.
That's what they will usually go to. And that's an interesting thing too, is that people think, oh, we're not like a university system when you're in private practice. You have to know the doctors. You have to know who you could go to, what OBs will be okay with you prescribing. Usually I'm calling them or their nurses. I'm talking to them, which never happens anymore. We don't see a team approach anymore unless you're at a university system in which you have the psychiatrist down the hall and the therapist in the same building. It is still grassroots, even though we're in a progressive city. We're still trying to reach for that and find people to help. And I totally believe in postpartum doulas too. And often I'll tell women that are, because I see women in pregnancy, put it on your registry. Put a postpartum doula on your registry as a present,
That's a great
because
idea.
they help, they they take care of the mom and the baby. Yes, maybe it costs a bit, but if you put on your registry, you're going to get some input for that.
That's right. Oh, that's
Yes,
brilliant. That's
yes.
great. Not having any more kids, but but definitely do that.
But these are the little tidbits of experience, like that happens over 27 years of doing this, is that, and often what's interesting about my women also is this is not in the typical risk factors. They're usually the star of the family, I call them. Usually the rock of the family. People always go to them with siblings or even in their immediate family. It's very interesting that I've seen that a lot. So when they are not well, people are generally like, she'll be okay. She always is. And you really have to push and like almost scream for help sometimes because they're used to you functioning so well.
Yeah. And to get to the point to actually get help and speak up. I mean, for me personally, it was my friends that stepped in and were like, okay, we've talked to Laura, who was a friend from church, and she found you and she made the appointment and they came over and I'm pretty sure they drove me to you. And they
Wow.
were just like, we just need to get you just 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 go. And I was like, okay, I
Right.
complied. I listened because I knew something was off. And I wasn't at this point, there was no saying no to them. But it was the best thing ever. Like that happened because had they not, I always say, I was like, I may not even be here to tell my story,
Well,
but
we in that postpartum period, and I even remember, you're not totally rational.
mm,
Like you're not totally irrational either. When you're thinking something, I was like boiling the pacifiers. I was a little bit germ phobic, and no one's going to tell me differently at that time. So it's very difficult sometimes to get through. And often, if a husband does it, the woman is feeling a little resentful in the way that she's like, well, I'm broken and you're good. And
mm,
sometimes that will make them not come to treatment because they're saying something's wrong with you. And this is a very difficult time for a couple. The toddler years, infant through toddler, marital satisfaction is very low. So what happens a lot is that this period, a couple is not always getting along very well.
yeah,
So,
I'm, I could, I can see that. Absolutely. And I mean, I do remember when Lucas went in, and it wasn't from a malicious
right,
w- place. It was just, I just call it, I mean, he'll be the first one to say it was ignorance. He just did not know. He came such a long way now. He's the one talking to dads and helping them
that's
through it. And
fabulous.
yeah, and by the time we had Dylan, we were on the whole thing where like I would do the last feeding, I would pump, and then I'd go to bed, and he'd be downstairs with both kids, and Dylan with whenever he woke up, he would feed him and then put him back to
Right,
sleep. So then I was getting a good amount of sleep. I mean,
right.
for a mom that just had a baby, it was like maybe 4 or 5 hours. And I still got postpartum depression the second time around, but I knew what it was. I was sitting on Judy's couch, but by like the next day, and it was easier for
Yes,
sure compared to
yes.
Lydia. But it still happened. Like I still got postpartum depression
Well,
again.
and it is important to note that about 70% of women have anxiety symptoms. So a lot of times we think it's going to look like a flat. That's actually a lower percentage. A flat, can't get up, can't get out of bed. It's more that anxiety, irritability, that symptoms that I see. Most women have that, and a lot of OCD, intrusive thoughts too, which are very scary to women. And actually, in my regular practice, I always now talk about intrusive thoughts because they are much more common than people think. That OCD and intrusive thoughts are really out there. And how many people, when I've said, do you have any thoughts that come out of nowhere and are disturbing to you, are saying yes to me, even 10-year-old kids.
Yeah. I remember like the things in my mind that were kind of coming out of nowhere, and I was just like, how do I just make it stop?
Right.
But
Right.
I do think talking about it and just saying it out loud, because then you can talk through it in a, okay, so let's say that does happen. What, like sometimes that takes power away from said thoughts.
Well, it's a OCD intrusive thought. That's my OCD. That's my thoughts. That's not me. I think women attribute it to, it must be me. That must be what I want to do because it's in my brain. And that is
Mhm.
not it at all. It's a
Yeah.
brain glitch. And there is evidence that if you've had generalized anxiety before, that you can have postpartum OCD more regularly than someone else.
So here's a question, and a friend of mine is pregnant. She's due, I think, in a couple months. I mean, she's at least in her third trimester, and she r- reached out and she was like, "Hey, I'm just feeling sad all the time. I'm worried. Is this normal? And when does it go away?" I started asking more. I was like, "Okay, like, can you narrow it down to what's making you anxious, or is it just like random? Is it like PMS kind of thing?" And where I'm getting at is during pregnancy, how soon can you start having symptoms,
Oh,
and what should they do?
it could be immediately. And I wish I got to see more women in the pregnancy period to see if they're at risk. So as soon as you have any symptoms, you can seek therapy. And there are times when people will come and we will do a certain amount of intervention. And then I'm like, okay, I think you're okay. Just come see me like 3 weeks postpartum. They get worried about themselves. So we assess the whole situation and do a few things to make them feel more like themselves. And then we assess again.
Me, it sounded hormones. Like, I was like, yeah, nope, those are what I said to her. I was like, yeah, no, those are your hormones. This is basically just how your brain is going to be. She does have a therapist. I was like, call your therapist.
Right.
I was like, if you, you're getting really down or you're having like crazy thoughts or something like that, definitely like call 911. Like, if you're something like that. But yeah, I was just curious about that. I was like, how early
Oh,
should
no, I see moms in pregnancy a lot. It is really proactive and good. And especially if you've had a previous postpartum episode, I really like to see people in their like second trimester because we're going to assess and we're going to problem solve. And we're going to be proactive and do whatever we can do to make that postpartum period better.
so how does working with moms like during their postpartum journey affect you on a personal level? And like, what are things that you do to keep your energy and protect your heart?
I'm still working on that. I think that's a constant journey. I would say you do get to a point where you put enough boundaries around yourself to not always take it home, to not, to when you leave the office, to, but there are some cases that do work on me that I want to do more for, find more out about, research things for them, especially if a woman is not getting better. That does affect me because it is people don't realize it is, most people recover from this. It doesn't feel like it when you're in it. But so when someone is not getting better, even like a little bit, then I am working in my mind as to, okay, what could we do? What more do we have to do? In addition to like working out and having downtime and watching my TV series and playing with my 150-pound puppy. Those are the things that,
Puppy?
yes, he's
150
two.
pound puppy?
Yes,
Oh, what kind of dog is this?
he's a half Cane Corso, half Great Dane.
Oh, yeah, puppy. Probably bigger than
Yes,
you.
he's a lot. So he keeps me
Oh,
very busy and active. So, yes, that is important for me to
Yeah, because I can't imagine the toll that it must take on you, wanting to help everyone.
Two new postpartum cases in the same day. I try not to do that because it is a lot, I feel, in that you're trying to help them to understand what they're going through and help them to know that they will get better. So it does take a lot of energy to do that.
That- And the thing is, like, you're so good at what you do, the way you break things down and the way, like, just,
Well,
I'm biased just because
yes, you're biased. I don't know that
I'm
everyone
biased.
would feel that way. You have to
No.
go to what fits. And I know what I'm not good at, so I don't do it.
Right? I mean, that makes sense. So if
Yes.
you had a magic wand,
Yes.
what's one thing that you would do to bring more awareness uh, to the number one birth complication, by the way, and to ensure moms are better taken care of? One
Well,
thing.
I couldn't do one. I had to do three. So
Okay.
one would be that women and couples are properly educated during the pregnancy period about what this looks like. Something like, oh, you have a type A personality. I used to go to the hospital maternity ward and give them handouts of the risk factors years ago to put in the packet so
Oh,
that women would look at that and maybe say, oh, I am at risk. We're not giving enough of the proper education.
right.
Um, I also would love there to be a mandatory assessment at the 2 to 3 month mark when women are at their peak of postpartum because usually the last person that sees them is the OB at 6 weeks, and you could not have any symptoms at that point. At 6 weeks, you could still be fine or not telling. It could hit you just like a ton of bricks at the 3 month mark and no symptoms prior to that. So 6 weeks is not great to only have assessment then. I think the third part is blood panel at the 2 to 3 month mark for especially thyroid, iron, ferritin, as well as other things. But I see so many women that are ferritin deficient. We don't get to examine that unless we ask for it very specifically.
Tell us more about that.
Okay,
What's that?
so ferritin deficiency, oh gosh, I don't know if I could explain it like a doctor would, but it is related to your iron, but it's not in the typical CBC panel. From what I understand, it's your iron storage. And women can be deficient in ferritin, but their CBC come back normal.
No.
And
Okay.
so they could still have an iron deficiency and are fatigued. And this is not just postpartum women. I've seen this with a lot of women, even young women, where we're having a deficiency and we don't know it. And
So how
recently,
do you get tested? Like,
you have to ask. You have to ask
okay.
for the testing. And, again, if you say CBC, that's the iron panel, but it's not inclusive with ferritin. So, of course, vitamin D, vitamin B, all of these, I, I often say, let's go medical first before we go psychological. We have to make sure all of this is is okay. Those are the three pieces that I'm really passionate about.
Okay. So how can people find you if they want to work with you?
I am on Psychology Today. They could find me there, as well as I work for Alma too, which is my Alma is an online platform. So I'm on there, and they could find me there. Within my private practice, in the office, I don't take insurance, but I do a moderate fee for people that cannot afford it. However, on Alma, I do take insurance. Whether it's myself or anyone else, I would just really encourage people to ask the right questions about the therapist. How many years experience, not just a certification. In addition to that, how many women have they treated? How many years have they been doing this, or even out of school? How long have they been out of school? I just think that there's little nuances that you have to know about this group of women that will be particularly helpful if you had more experience or supervision.
Right. So before we wrap up today's episode, I want to take a moment to express my heartfelt gratitude to Dr. Thorne. Thank you for sharing your expertise with us and all the insights. I know a lot of women are gonna do the whole and nodding their head.
Mhm.
I can already see it. To our listeners, thank you for tuning in. If you found this episode helpful, please feel free to share it and consider subscribing to Calm Your Grits podcast so you never miss out on more insightful discussions. And remember, you're not alone. Until next time, take care and keep shining.